Welcome. Today we're going to discuss exercise and diabetes. I'm Catherine Staton, a cardiac rehab supervisor at Toronto Rehab. Today our learning objectives are to understand how exercise helps to manage our blood sugars. We're also going to understand how exercise can be done safely to manage our diabetes and to further support our blood sugar control. We're going to learn how to exercise safely to manage our blood sugars, to reduce the incidence of having a low blood sugar or hypoglycemic response. And we also want to ensure that we're exercising safely to not elicit a high blood sugar response or hyperglycemic response. We're also going to understand how to prevent foot injury and foot ulcers. So what's the role of exercise in controlling blood sugars? I've used this slide to illustrate the point. When you take food into your stomach, the food is digested and absorbed up into your bloodstream in the form of glucose or blood sugar. To get that glucose or blood sugar into the cell for use, you need insulin to open the door or mediate the response, allowing the blood sugar to get into the cell for use. For someone with type 2 diabetes, they typically also present with a form of insulin resistance. So they may have a lot of blood sugar, excessive blood sugar circulating in their bloodstream, and they also may have an awful lot of insulin circulating in their bloodstream. But because of a dampened effect or a resistance at the level of the cell, even though there may be a lot of insulin in the bloodstream, it doesn't as easily mediate the transfer of glucose into the cell. The good news is exercise is the key that opens the cell, allowing glucose to get into the cell along with the support of insulin. So it lessens the insulin resistance. When you're exercising, you want to ensure, obviously, that when you're exercising, you do so safely to ensure that your session will be effective. A few things to consider when it comes to exercise safety. You want to ensure that you are eating within 2 hours of when you plan on starting your exercise. If you're on insulin, you also do not want to exercise when your insulin is at its most potent or most active. As well, you do not want to begin your exercise with a blood sugar less than 5.6 millimoles. Doing any of these things, or failing to do any of these things rather, will lead to concerns in terms of you having a low blood sugar or hypoglycemic response. So ensure that, again, you eat within 2 hours prior to when you plan on exercising, and ensure that your blood sugars are over 5.6 before you start. Hypoglycemia. For some of you, you may have had a symptom of low blood sugar or hypoglycemia. Some of the typical symptoms are trembling or feeling shaky, having difficulty concentrating or thinking. Some people liken it to sort of thinking that they feel like they're in a bit of a fog. Feeling sweaty and hungry. And hypoglycemia, or a low blood sugar, is clinically diagnosed when a blood sugar is too low, meaning less than 4. So you're having a hypoglycemic response if your blood sugar reading is less than 4. In the case of this, you want to act quickly. You don't want to wait very long. If you're exercising, we ask you to stop exercising and sit down. You want to eat or drink 15 grams of a fast-acting carbohydrate. And the key is a fast-acting carbohydrate. So some examples are glucose tablets. There's a picture there. And you can look at the side of the glucose tabs to find out how many carbohydrates are in each tab. You want to have a total of 15 grams of carbohydrates to raise your blood sugar and respond to the hypoglycemic response. So in most cases, you'll need to take 3 or 4 glucose tabs. You can also respond to a hypoglycemic response by having some juice, apple juice or orange juice. Those little drink boxes are really handy for this. Look at the side of the juice box to determine how much juice you need to take to consume 15 grams of carbohydrate. Typically, it's between half a cup and 3/4 of a cup of juice. You can also use regular pop. Again, take the amount of pop equivalent to 15 grams of carbohydrate. For this purpose, you do not want to use diet pop, as you have no sugar in diet pop or no fast-acting carbohydrate. You can also use table sugar. So 4 little packets of table sugar dissolved in water is equivalent to 15 grams of carbohydrate. So you'll take your 15 grams of a fast-acting carbohydrate to respond to a low blood sugar or a hypoglycemic response. And then what you want to do is wait 15 minutes and then retest your blood sugar to ensure that step 3, or taking that 15 grams of carbohydrate, has actually risen your blood sugar. If your blood sugar is still less than 4 after the 15-minute wait period, you want to repeat steps 3 and 4 until your symptoms resolve and your blood sugar raises to a level higher than 4 millimoles. Certainly, you also want to provide some follow-up. So if your next meal is greater than an hour away, perhaps eating a slower-acting complex carbohydrate snack like a granola bar would be a smart idea. Other safety considerations: we want to prevent exercising when our blood sugars are too high or you have a hyperglycemic response. So for those that have had high blood sugars, typically they've felt symptoms that include being very thirsty. Perhaps they feel unwell and tired. Perhaps they're having stomach pain, nausea, or vomiting. They'll experience sometimes blurred vision. So you're not lining things up with your vision quite as well as you normally do. And some people frequently feel an increased need to urinate. So some causes of having too high a blood sugar are because of the ingestion of perhaps too much food, or more importantly, carbohydrate. So perhaps too much carbohydrate will raise your blood sugar to a level higher than where we'd like it for when you start your exercise. Sometimes our medications need to be tweaked, and that's the cause for our high blood sugar. And certainly stress and physical illness can do it. So if you're feeling unwell, if you're sick, your blood sugars tend to be higher than when you're feeling well. So depending on whether or not you're on insulin or not, we have different protocols. If you're on insulin, whether you have type 1 diabetes or whether you have type 2 diabetes, we do not want you to proceed with starting your exercise if your blood sugar is over 14 millimoles. Before starting your exercise, consult with our exercise class physician or our case manager to ensure that in your case, exercise will be safe to do. You want to avoid exercise altogether if you've forgotten to take your insulin. And you do not want to exercise if you're feeling unwell. So as I mentioned earlier, when we're feeling unwell, when we're sick, our blood sugars tend to rise. If you're feeling unwell and your blood sugars are high, perhaps it's an idea to not exercise that day. Perhaps your body's trying to fight off an illness. If you're not on insulin and you're having a high blood sugar response or hyperglycemic response, we do not want you to proceed with starting your exercise if your blood sugar is greater than 16. In a case such as this, we want you to consult with an exercise supervisor or a class physician to again ensure that exercise is safe for you to do. Again, we don't want you exercising if you're feeling unwell. This is a form, the blood sugar tracking record, that we're going to ask each and every one of you to fill out, and it tracks your blood sugars in relation to exercise for a period of 1 week. We'd only like you to fill out one of these forms. So we'd only like you to check your blood sugars in relation to exercise, before you exercise and after you exercise, for a period of 1 week. The blood sugar tracking record is something you can fill out in conjunction with your exercise diary. So every day you do your exercise, we're going to ask you to fill in the date that you exercise, the time that you exercise, your blood sugar before you start your exercise. And remember, we do not want you to start your exercise if your blood sugar is less than 5.6 or over 14 if you are not on insulin, or over 16 if you are on insulin. We don't want you to proceed with exercise if you're feeling unwell. Mark down your blood sugar before your exercise. You'll complete your exercise session, your warm-up, your exercise, your cool-down, and then check your blood sugar thereafter and mark down what your blood sugar is after the exercise. In the comment column, you can write down perhaps when you ate prior to your exercise or any symptoms that you're feeling, and your case manager can review your blood sugar tracking record with you after the week to give you some support and some follow-up. What's great about the blood sugar tracking tool is it'll give each and every one of you an idea about how your blood sugars respond in relation to the exercise. One of the safety considerations we also want to take into account is the prevention of foot ulcers. So certainly we want to make sure that everyone, when they're exercising, that their feet are in good care and that there are no active blisters, injuries, or ulcers. So some of the things to consider: you want to ensure that you see your foot doctor or chiropodist regularly to maintain a good level of foot care. You want to know how to care for your feet, and the next slide is going to go into foot care in a little greater detail. You want to ensure that you keep your feet dry. You want to monitor your feet daily before and after you exercise to ensure that there are no abrasions, blisters, or irritations that are starting. You want to ensure you're wearing the proper footwear, so ensure that you get well fitted for a pair of training or running shoes, even when you're exercising in the winter months. You want to check the inside of your shoe for any rough edges that may catch on the skin of your feet and cause abrasions. We encourage you to wear polyester or cotton polyester blend socks to help with breathability when you exercise, when your feet are sweating. This will ensure, again, that your feet stay dry while you exercise. What you can do with your socks as well, if you find that the seam on the sock tends to abrade your toes or cause some irritation for your toes, you can turn your socks inside out so the seam is on the outside and therefore not rubbing against your toes. Some of our patients use silica gel or air midsoles. When you're going through the program, you'll find you're doing a heck of a lot of walking, and we encourage you to look into getting nice cushioning insoles to certainly help with further support and cushioning, taking the brunt of the effort off the sole of your foot. What to do if you develop a blister. So you've started the program, you're doing your exercise, and a blister occurs. We want to make sure that we're not just laissez-faire when it comes to blisters. We want to ensure that we treat a blister quite seriously. Remember, a blister can develop into a foot ulcer. So you want to speak with your cardiac rehab supervisor right away to get some feedback about what you should do to manage your foot care in terms of developing a blister. We'd like you, for the most part, to discontinue your weight-bearing or walking exercise until the blister heals. Or perhaps your cardiac rehab supervisor will be able to develop a non-weight-bearing exercise alternative so that the blister isn't getting further abraded and further pressure on it. We also encourage you to follow up with your doctor, your chiropodist, if needed, if a blister develops. In terms of proper foot care, we'd like each and every one of you to follow the following practices. You want to wash your feet daily, keep your feet dry, and keep your feet soft. So when you're washing your feet, check your water temperature to avoid burns. And you want to do so using the inside of your wrist, not necessarily your fingertips. Wash your feet daily with warm, soapy water, so not hot, hot water. And after you wash your feet, you want to ensure that the feet are really, really dry, especially the areas between the toes. This will reduce the incidence of fungal infections. Afterwards, you want to apply cream to your dry skin to keep your feet soft. This will obviously reduce the chances of developing corns and calluses. As well, you want to regularly cut your toenails and inspect your feet. So checking your feet daily, as I mentioned, cutting your nails straight across, and filing your edges with a nail file. Do not use over-the-counter products without checking first with your doctor to see if it's suitable for use for someone with diabetes. Do not cut your own calluses and corns. Do not treat your own ingrown toenails or slivers with a razor or scissors. For all of those items that I mentioned, the do nots, we encourage you to follow up with your chiropodist or foot doctor to get proper support and foot care. In fact, a lot of chiropodists would prefer to actually cut your nails directly instead of having you do it at home to ensure that they're done well and again not causing any ingrown toenails. Clean any minor scrapes with soap and water and cover and protect the scrape with a Band-Aid, and contact again your doctor or your foot doctor immediately if cuts do not heal. And certainly any open sores need immediate attention. We don't want anything developing into a foot ulcer. In summary, regular exercise helps to control your blood sugar. It's a very effective mode of managing your blood sugars. Again, if your blood sugars are too high to start or too low to start, so for example, if your blood sugar is over 14 to 16 millimoles per liter, your blood sugars are too high to start your exercise, and we want you to consult with your class physician or your exercise supervisor before you start. As well, you do not want to exercise if your blood sugar is less than 5.6, and certainly ensure that you're eating within 2 hours of the start of your exercise session. Self-monitoring your blood sugar tells you how your body's responding to exercise. So for each and every one of us with diabetes, exercise and certainly the response on your blood sugars differs. So use your blood sugar tracking record to find out how your blood sugars respond in terms of a bout of exercise. Low blood sugar needs to be treated immediately with 15 grams of sugar. We mentioned this early. It's the 15-15 rule. So if your blood sugar is less than 4, if you're feeling symptoms of a hypo or low blood sugar response, you need to certainly respond with 15 grams of a fast-acting carbohydrate like glucose tabs, apple juice, orange juice. Wait 15 minutes and then recheck your blood sugar. Again, to reduce the incidence of lows, with a blood sugar less than 5.6 before exercise, consider having a snack before you start. And certainly your medications may need to be adjusted if you're experiencing frequent low blood sugars. Regularly check your feet for injuries, so we recommend before and after exercise checking the feet, wearing proper running or training shoes, and reporting any injuries to your case manager and your physician so that you can get further support and follow-up. Thank you.